Welcome to Vet with a Mic, content driven by veterans issues. I want to talk briefly about the surrounding factors that impact utilization of mental health services by veterans. Let's start off by just talking a little bit about what type of providers there are available to you, not only at the VA, but from civilian sources. The first major category that you've probably heard quite often is psychiatry. Now, a psychiatrist is a medical doctor who received additional training to deal with medicinal approaches to mental health, a modality that utilizes medication for mental health issues. Now, that's not to say that they won't still engage in talk therapy, because some of them do. But on whole, when you're seeing a psychiatrist, you're usually at the end of your time going to receive a prescription for medication. Now, people may have varying opinions about the use of medication to manage mental health issues. But for some people, it is quite possibly the most effective thing that they can do. Some mental health issues just require the use of medication. And so I understand all the hesitancy that might be out there about using medications that augment how you feel. But for some, it really is the only game in town that they have available for them. So if you're a person who has strong opinions about the use of medication, understand that for some, that is their best option to have relief over their symptoms in their life. So psychiatry being one of the main familiar words in which you may have heard within the realm of mental health. The second one you've probably heard is psychologist. Now, a psychologist is someone who has been trained at the doctoral level, meaning they have either a PhD or a doctorate of psychology in the treatment of mental health issues. Now, they do a lot of work within the testing and diagnostic arenas, meaning they may be the one who performs an IQ test, for example, or they may be the type of professional that you go to whenever you need very specific issues addressed by a test that has been designed to evaluate a person for a particular disorder. Now, psychologists also spend a good amount of their time doing talk therapy. And there's a few different approaches that are most common, especially within the VA. In the VA, you can see what is called cognitive therapy or cognitive behavioral therapy, in which this type of treatment focuses on your thoughts, changing the way a person thinks about themselves or the environment or the world or the future. And it is remarkably effective. I've seen some percentages in the 70s that they are as effective as medication. So cognitive behavioral therapy specifically. Now, in I believe it was 2020, maybe 2019, the APA had done an in-depth review over the different types of talk therapy that were available to the consumer. And they found that almost all of the types, almost all the approaches that are utilized within talk therapy have therapeutic gain. So instead of getting caught up in, oh, I want this kind or that kind, there seems to be something in just going to a mental health provider that does make you feel better. Now, after those broad terms, psychiatrist and psychologist, there's this third term that's a little bit more confusing. Counselor, or you may have heard therapist. Now, there are a lot of different types of mental health providers that can be described as a counselor or as a therapist. A counselor is usually someone who has been trained to the master's level and has a state license. They have permission from the state to perform mental health services. It's well regulated. There's a standard in which the state and that particular discipline upholds. And so you can trust that reasonably those type of people that are counselors and they are licensed by the state are trustworthy to perform mental health services or for you to receive mental health services. Another kind of caveat, another brand of, I know that the licensed clinical social workers out there, if you're listening, you'll probably get a little angry, but something that's like a little adjacent to counselors are licensed clinical social workers. Now they also do talk therapy. And then there's a third category. It's like a pastoral counselor. And they are more of the religious focused, which I would be doing a disservice if I did not elaborate just a little bit. The word counselor is not a controlled word, meaning a lot of people can call themselves a counselor, but it doesn't mean that they're trained to the standard for licensing. You know, there's a lot of religious organizations. Hell, there's financial organizations that will use the word counselor. But if we're talking about actual treatment, if they're not licensed by the state and there is not an accrediting body of some sort, whether it's a professional organization like the APA or the ACA, which is the American Counselors Association, or the Social Workers Association, if they're not held accountable to some regulating body beyond just even the state, I would tread softly about whether or not I would seek services from them. There's nothing wrong with religious counselors. There's not. But they can tell you a lot about your faith or their faith or what their religious arena may think is the right approach. But when it comes to actual mental health treatment, that's not their function. Everybody can retain their own private faith, but when we're talking about mental health issues, we really want somebody who has been trained in the ways that we know are scientifically effective. And there has been quite a bit of rigor that goes behind the approaches that psychiatrists and psychologists and mental health counselors and licensed clinical social workers that they use. And we know that they are effective for mental health issues. Now, the last one, and this is a therapist, is a licensed marriage and family therapist, is another one in which you may have heard. And they also have a very specific set of standards that are imposed not only by the state, but their own professional organization to have a certain amount of quality control for the consumer. And so whenever you're out there, like just you're whether you're navigating the VA system or you're utilizing resources outside of the VA through maybe community care, or you're just using private insurance, it's important to pay attention to what letters come after the people's name so that you know what to expect. Because if you're I don't want to use medication and you go to a psychiatrist, well, you're going to be charged for the visit and you're just going to walk away going, I'm frustrated. Or if you're needing medication and you go to a psychologist, well, you may have wasted inadvertently some of your time and some of their time. Now, something that just has to be addressed here quickly is there may be a time in which you use all three types of providers that we just talked about. You may have a medication that is prescribed for you. You may have testing that was done by a psychologist. And you may have weekly counseling sessions done by a licensed clinical social worker. That actually, all three of those things will happen at the VA. And you'll have three different check in the boxes that you go to. Well, at least the psychologist may be only once. But people, the types of providers that we've talked about are important when navigating what type of care you'd like to receive. And like I was saying, these terms kind of get thrown around a lot. And they're almost used interchangeably. But their function and how they approach treatment, they're completely different. They can be used in collaboration, and they often are. But understanding what type of provider you're going to see and what expectation you can have from them is going to be of the utmost importance for the veteran that's going. Let's talk about what we can expect from the therapeutic process. Now, say you're going to a psychiatrist. A psychiatrist is going to prescribe you a medication to take. Now, unlike something like a antibiotic that will have quick effects upon the body, medications that are designed to treat mental health issues have a little bit more of a tricky process to get to where they need to go. So medications are not precise because they have to pass through the barrier. They can't just go to a very specific part of the brain in which they need to go. And because we have not figured out the way to have a more precise delivery, it takes time for the brain chemistry to adjust when medications are added. So it may take 2-3 weeks for you to start noticing the effects of the medication. And it's the same way with talk therapy. If we could go to talk to a counselor or to a psychologist, and in one day we just immediately start to feel better, that would be a remarkable thing. But unfortunately, with talk therapy, it takes a little bit of work. There's oftentimes they give you homework to take home, assignments for you to kind of sort through and apply the material that you have learned in your life that week. And so it's work. And so there are no easy fixes for mental health issues. There's no magic pill, and there is no magic session that you can go to and just immediately walk away feeling better. But I can tell you that if given time and enough effort, you will start to notice results. But your expectations have to be in line with what's realistic. And because if you go into it with unrealistic expectations, you're going to be discouraged whenever things don't go the way in which you imagined that they would. Now that we've kind of talked about expectations for treatment, I think we should start narrowing in our focus a little bit more. So now we understand what types of professionals are out there available to us. Now we should talk about what we need for an effective treatment. So you've heard of potentially this idea of goodness of fit. So people have different personalities, they have different styles and different approaches. And it's important for a therapist and a client to have a good rapport with each other. There needs to be a good fit between the two of them. Now, you're not going to know this necessarily straight out the bag, or sometimes you may. You may walk into an office and go, nope, I don't like that guy. Nope, I don't like her. And I'm not saying that you should immediately just trust your intuitions right there on the spot, because it can be more complicated than that. But if there's not a sufficient amount of trust that you're feeling with the provider, it's going to be hard for you to make gains within the therapeutic setting. They're not there to fix you. In a lot of ways, therapy is a sounding board, not there to give you guidance. They're not there to tell you what to do. They are there as a one-way relationship. They're not a friend. They're not a family member. Because friends and family members, they have expectations for you and your life. If I'm your friend and you're talking to me about some problem you got going on, well, I have a vested interest in how you resolve that problem. Let's say you're having a problem with a spouse. I'm your best buddy, and I don't like your spouse. I liked what it was like before you got married to them. And you're telling me you're having trouble with your spouse. Am I going to be able to objectively give you what you're needing in this conversation? I would say that most people would find it hard to not say to their buddy, well, I never liked them anyway. But in a therapeutic setting, that provider comes with no previous knowledge. They don't have a vested interest in some outcome that benefits them. You get to come in there and talk about your problems, but you don't hear about the problems from the therapist. But when you talk to a friend, oh yeah, buddy, let me tell you, you think you got it bad. You got to hear what I got going on. And so a lot of people have this attitude like, oh, well, I don't want to go to a therapist. I mean, I'm not going to pay somebody to be my friend. You're actually paying them not to be your friend. Because friends have limitations within their relationship. One of the things is they can't be objective. They cannot be objective. They're going to be on your side. Maybe you like your spouse. Maybe you want to work things out with them. And the friend comes across as if they're only concerned with one aspect of the issue or problem that you're dealing with, which is you. But when you're in a relationship like that with a person, you have to consider their other perspective. There's give and take in a relationship. That your friend is not going to be able to really suspend that part of themselves and accurately talk with you about your problem. But a therapist, whether it be a counselor or a psychologist or a licensed clinical social worker, are going to be able to do that. That's what their job is. That's what their training is. Now, once we've established the goodness of fit, once we have that completely hammered out, a lot of times I hear issues coming from veterans revolving around just misconceptions about therapy. One of those misconceptions is this fear of reprisal. And it goes back to our military days, most likely, because we all knew a service member who was having a tough time adjusting and asked to speak to somebody. And as soon as they did that, their chain of command pulled them out of the ranks and had them doing something like sorting mail for the command. And it was potentially a humiliating process for that service member. And ironically, the chain of command made that person feel worse because they separated them from their entire social support. They removed them from their coworkers who are their surrogate family while in the uniform. So I think that's where this concept kind of arrives from. Veterans are afraid to speak openly because they have had punishments or have seen punishments by the commands or from their employers on people who asked for help, from people who asked to speak to somebody. And so that tendency may be entrenched in us pretty deeply. That tendency to shy away from expressing wanting to be transparent about emotions or problems we're having. Because there was a real risk to your career while you were in the uniform if you didn't navigate that just so. So maybe you got burned by a mental health provider in the uniform. Maybe you had a bad experience with them. I understand it happens because people, even ones who are trained to a high degree within mental health, are still subject to error. But let me just reframe something for you. If you talked to somebody while you were in the uniform, that provider had a greater commitment to the mission, not just to you. But when you talk to the provider outside of the uniform, you are their greater commitment. So in the uniform, if you said something to somebody who was a mental health provider, especially if they were in the uniform too, they have to potentially break your confidence and talk to the command structure about a possible attrition issue. If you're going to lose somebody who is essential to mission completion, the chain of command, that commander, has to be informed of it. But in the civilian world, or even at the VA, their ultimate loyalty is to you. There is no mission. You are the mission. So let's talk about this idea that comes up rather frequently, especially when I talk to cop buddies who are prior military. Confidentiality. What is the term confidentiality? In a nutshell, confidentiality is a interaction that is kept private between the mental health provider and the client. So within this interaction, the mental health provider is legally compelled to protect your privacy, and anything that is said within the context of the therapy session is considered privileged communication. Now, you may have heard that word before, privileged communication. It's similar to like an attorney and their client. It means that no one can use those interactions against you in the court of law, for example. So I hear a lot of people talk about, well, I'd go talk to somebody, but, last thing I'd want is my boss finding out about it. Your boss isn't going to find out about it. The mental health provider, their ultimate fidelity and allegiance is to you. Now, there are some caveats to there, All right, there's some exceptions. If you are going to therapy and your employer is sending you to it, or it's required by your employee, or it's required by the court, then guess what? They probably have access to whatever is said to the provider. And the reason is in the very beginning of the treatment process, there's this time in which the therapist and the client go over informed consent. During the informed consent process, the provider will tell you who the client is. Now, if it's something that's been court appointed, you are not the client. The court's the client. If it's something that your employer is mandating to you, you are not the client. The employer is the client. Similar to the chain of command issues that we just talked about. If they are the client, and it will be described to you within informed consent, that very first meeting, then what you say can be used outside of the therapeutic setting. But outside of that, what you say in the therapeutic setting is privileged. It is confidential. They protect your privacy. Now, there's a lot of case law that goes into it, but there's only one exception, and it can be described as multiple, but one is it's really just a threat to yourself or to others. If you talk about abusing your child, most states have mandatory reporting for mental health providers. So if a child is at risk, you say you've been abusing your child, they're going to have to break confidentiality because there's another person that's at risk. If you make a comment about wanting to go harm somebody, now I don't want to go into too much detail, but there usually has to be a specific target in mind. So, but if you say something that the therapist, the psychologist, the psychiatrist believes that you're about to go harm somebody, you're about to go commit murder, well, they have to inform the police. And in some states, they have to actually warn the intended target. Now, suicide is always an issue that comes up within the mental health setting because, well, there's some dark content that can be talked about within the mental health setting. So when it comes to suicide, if you say something that leaves the provider to believe that you're about to go commit suicide, obviously they're going to try to save your life. They're going to try to intercede on your behalf. I don't think that should be too surprising that the person would try to intercede on your behalf. But even if they do have to break confidentiality, there are still some constraints on what they can and cannot say. So a lot of times I hear veterans concerned about if I go get a PTSD diagnosis, they may take away my guns. That's not how it works. And I'll be honest with you, a lot of the times veterans can get a little squirrely about answering the suicide question, which I understand. I understand. I do. Because you don't want to be misrepresented. And having suicidal thoughts is pretty common. Everybody at some point in their life has had a suicidal thought. So the onus can be on the provider themselves to have to make a clear judgment call as to why they have to break confidentiality. Because listen, there's no magic tool that a therapist or a psychologist or a psychiatrist can use to evaluate how likely a person will be to commit suicide. It's hard to predict that. That's why if you've had somebody close to you who've committed suicide or has attempted suicide, understand that's hard. Even trained mental health professionals may not have noticed the signs in time. So understand there's not some magic tool that a clinician or some mental health provider can use and go, yep, that was it. Take their guns away. Usually it comes down to details. Now, if you say, I am going to go home today and I'm going to commit suicide at 3 p.m. using this type of delivery, whenever I know this person couldn't stop me. Those details, those specificities would leave any reasonable person to believe that you were going to harm yourself. Now, I'm saying all this. This is not taken. You should not take this as any kind of professional advice. Every single person's particulars and context are different. No one there's no model that you can use. All right? So don't take this and say, well, yeah, that one guy I heard. Yep, that means there's not a problem. There's not a threat. There's no risk. Because like I just said, even people who have been trained for years have things that they miss because there's no precise tool to use to evaluate suicidality or homicidality for that matter. It's hard to know whether a person's going to go harm somebody else or themselves. We have not developed perfect ways of detecting it. So just because you seek out mental health services doesn't mean that you have given up your legal rights to anything. Because a mental health provider must have articulable reasons for violating your confidentiality. And to be frank, they better be damn good ones too. Because, like for example, I'm a member of the APA. The APA has strict guidance for what their ethical standards are. And there is a grievance mechanism in which you can utilize to file an ethics complaint on people. So providers should take that confidentiality and breaching it with extreme caution. And let's be frank, or John, or William, whoever you want to be. If you can be mildly inconvenienced for a moment until you can get the help that you need, I don't think in 5 years you would be worried about something like, oh, I said the wrong thing in a therapeutic setting. Because I can tell you from personal experience that you are going to be allowed to emote. You're going to be allowed to express yourself. Often within military populations, there's a lot of anger. There's a lot of pain that comes spilling out in a therapeutic setting. And so a provider, especially within the VA, is going to be used to hearing that on a daily basis. So you don't have to censor yourself, because sometimes things, especially when it comes to uniform-related things, are intense. You may cuss. You may feel like yelling. You may feel like crying. But there's strong guidance that the mental health professionals have to adhere to when it comes to protecting your confidentiality and the communication that happens between a client and a provider. And don't take this as a all or nothing kind of guidance. This is not professional advice. Because every single state has different laws and different guidance. And we're talking about, generally speaking, what's put out from the professional organizations. Different states have different laws. Adhere to the laws and find out what they are in your particular jurisdiction. But I'm going to tell you, for me, being mildly inconvenienced and maintaining or still having a person around, them still being alive, that would totally be worth it for me. I know some people out there might not feel as if that would be mildly, but I understand. I understand we feel passionate about things like the Second Amendment. I do too. But as long as the provider tells you who the client is, and you understand that as long as you don't make a credible threat against yourself or another person, or if they do not feel as if some protected class of people, whether like children, for example, are at risk or in danger, you have confidentiality. Those are the exceptions. If you're the client, you have confidentiality. And the state can't even compel somebody to testify. Now, you can waive your confidentiality, so do so and understand that if you give authorization to somebody, then you have waived your confidentiality. You've extended it to another person. Okay? So you're the one that's in control of your own confidentiality. With the exception of those few incidences where I said if you're not the client, if there's a credible threat to you or to another person, or if there's some risk to a protected individual like a child. See, as long as you stay within those bounds, everything you say within a therapeutic setting is safe space, man. I know that we don't like that word necessarily, but it is. That means it is a protected place. You can be who you are. You can say whatever you need to say to engage in the therapeutic process. Well, we've ran a little longer than I expected us to for today. I hope that those out there listening have taken what I've said and have found some utility and usefulness within their life. Because these issues can surround how veterans interact or how they utilize mental health services. There are tons of resources out there available to you within keystrokes as well. I want to take this opportunity to also say this. If the VA isn't for you, don't let that stop you from going to receive mental health services. I understand that there's plenty of hesitancy to utilize the VA, but understand within whatever part of the world you're listening in, whether it's in the state of Alabama or the state of Washington, there are programs specifically designed to helping people utilize mental health services who are uninsured or underinsured. So if you're a veteran out there that doesn't want to use the VA and you're uninsured, look up whatever place that there is for you to go that is subsidized by the state to perform what has been termed safety net services. And at any point, you feel as if you can't wait to talk to somebody, reach out. Utilize the mobile crisis numbers. The Veteran Crisis Line is available 24 hours a day, 7 days a week. And the number is 1-800-273-8255. Yet again, that's 1-800-273-8255. Or you can chat confidentially at veterancrisisline.net or text to 838-255. Yet again, that's text to 838-255. If you are ever in doubt of needing to talk to somebody, reach out and call into that number. They are veteran friendly and they are standing by at all times. Because one thing that you may hear about suicide or feeling in crisis is you're always ambivalent. You're never 100% that this is what you want to do. You go back and forth. You're just waiting on a reason to live. You're waiting on a